Welcome to today's podcast of Doctor's Insight with the iOrbit team. So today we are taking you to the most important special place of the hospital, the Neonatal Intensive Care Unit. And today we have with us Dr. Archana of ma'am, one of the renowned neonatologists and is highly trained in this field. So doctor, what exactly is a neonatologist?
Hi, a neonatologist. Not many people are aware of this field, of this specialty. A neonatologist is a doctor who takes care of newborn babies, specifically newborn babies or babies less than 28 days old. So it is a sort of super specialization. We become doctors and then go through pediatric training and then further train in neonatology.
Okay, so what is an NICU?
So yes, that's where I work, in the NICU. NICU stands for Neonatal Intensive Care Unit. This is a very special place where we take care of babies who are just born up till 28 days of life when they come back with problems. So it can include premature babies as well, that is babies who are born early, or it can include even term babies that are born with full 9 months gestation.
So how do you treat such babies with such conditions?
Now we admit them, we see what problems they have, and depending on what problems they have, we do the necessary treatment. Now St. Philomena's Hospital has a level 3 NICU, state of the art NICU. We have all the facilities here, including ventilators, CPAP treatment, IV fluids, total parental nutrition, all sorts of medicines. We are a team of doctors and nurses who are very much dedicated to this field.
So coming back to NICU, how well do the babies in NICU do?
Well, most babies in NICUs all across the world do really well, having given the right treatment for their problems. So I would say more than 99% really do well.
Okay, so
there are only a few that don't make it because of genetic problems or some anomalies that they have.
So what are the common problems that babies have being born in within 30 days during that time period?
Yeah, there are two types of babies. One is term babies, other one are born early, they are called as premature babies. Now term babies, most of them do fine, but they can have problems like breathing problems, they can have jaundice, they can have infection as well. Whereas preterm babies, depending on how early they are born, they can have multiple problems. The earlier they are born, the more problems they have. They can have premature lungs, they could have high jaundice, they could have infection, they could have bleeding in the brain, they can have infection in the intestine. So there are a multitude of problems that premature babies can have. But most of this get tackled really well and they do recover very well.
Yeah, okay. So coming back, you said you have a very well competent team in Philomena Hospital. So do you also have a well competent nurses in the NICU and how are they trained?
I can proudly say that the nurses in my unit are among the best in India, maybe even in the world, because we train them to be so. Now these nurses, when they join the NICU, they usually don't have much experience in this field at all. Neonatal nursing is very different from nursing in other parts of this hospital. So they need to be highly competent and highly skilled. They should be aware of the neonatal problems and how to assess the problems. So they are among the first ones to see the problems and inform the doctors. And they're very skilled in all the procedures. So I would say they're a good team that we have.
Great.
And we train them on a regular basis.
So is there any special teaching techniques you hospital have used to train such well nurses?
It's mainly classroom style teaching with discussions, small group based discussions, and sometimes writing material, quiz presentations, and teaching during rounds, practical teaching.
It's all
yes.
practical.
It's all, yes.
Yeah.
Yes.
So what personally inspired you to choose this field?
That's a wonderful question. I myself ask of myself that question, why did I choose this highly stressful job? Now when I trained in MBBS, I had no exposure to the NICU, I didn't even know what it meant. But when I went abroad and I did my pediatric training, one of the first postings was NICU. As I stepped in, looking around at all the babies, the varying sizes, how sick they were, I just fell in love with them. And it became a passion, and I knew right on the second day in my rotation that I wanted to pursue this field. In fact, not just pursue, I wanted to get trained in neonatology and then come back to India which I done. I came back in 2006 and I've been working here since then.
Great, great. So how do parents get involved in NICU?
I involve parents in my NICU as much as possible, right from day one. Okay, one, the mother has to give breast milk. Other than that, I encourage them to do kangaroo mother care. Not just the mother, even the father, the grandparents, so that bonding takes place. Kangaroo mother care means keeping the babies on the chest and just sitting there for some time, bonding and talking to the babies. So it helps babies a lot. So I involve the parents there. I involve them in all the nursing activities. So by the time they're ready to go home, they know so much about taking care of the babies. You can say half nurses already.
Nice. So general people are not aware what common problems the babies might have when they are just given birth. So would you like to aware the public about this?
You'll be surprised actually when babies become admitted in my hospital in this unit. Parents are taken by shock. Like they are like, what is this NICU? Why is my baby having problems? So most people are not aware of the term NICU and they're not aware that babies can have problems. They think that all babies are born fine. So what I would like to tell all parents, all expectant parents you would say, is that yes, most of the babies are born fine. 10 to 15% of babies are born early and they can have multiple problems. And even if they are not born early, they can still have problems during delivery and after delivery. So what I would like to tell the parents and people there is that be ready, something can go wrong. Make sure your baby is born in a hospital where there are trained pediatricians. Preferably there should be an NICU as well, so that the baby doesn't have to be transferred to another hospital. And then once they get admitted, most babies do well. Trust the doctors, trust the team, and your baby will do fine. And after the baby is discharged, make sure you give regular follow-up. Means you take the babies to the doctors on a regular basis. Many times I see that once the NICU is over, they take the babies home and they treat them like any other baby. But that's not the case. NICU graduates, means the babies who come out of NICU they require more care. So they do need to follow up closely.
Great.
iOrbit team is doing a fantastic job with raising public awareness and creating publicity for the hospital. St. Philomena's Hospital is an excellent hospital where you get first class treatment with warmth and love. Now I have been here since 2006 and it's a wonderful place to be. I have not left yet. So I wish iOrbit Digital Technologies the very best in this work.
Thank you. Thank you so much, ma'am. You've been very great.
Thank you.